too. I bet there's a microphone there. Okay, let's see. Can y'all hear and see the starting screen yet? How's everybody doing? Good to see you guys. Thanks, Go-Kart. Awesome. All right, let me know in chat if you have any comments or need help with any certain codes or have any information to share. Let's get started. I'm so glad you're here too. Awesome, awesome. Hey, Elizabeth, good to see you. I got some practice questions I wrote, so I'm going to throw them up here and you guys can tell me what you think the answer is while I catch up with chat. Hey, Jessica. Hey, Sheer, Vicky, Crystal, Samantha, Kim, Ada, Louisa, Go-Kart, Kim, Danny, Virginia, Kim, Colin, Crystal, good to see you. Hey, Mabel, good to see you. Hey, CF. I'm finally out of Facebook jail. It's been like 2 months. My page, not my group, but my page was like under attack or something. I don't know. At one point it said that I was impersonating another business or something, which is crazy. I own Medical Coding by Jen. It's an LLC actually, so I own it. So that was weird. And then, I don't know, it said that I violated some sort of guideline. I have no idea what guideline, but I don't know. It took me 2 months, but I'm finally back in business and can post as Medical Coding by Jen, which is great. I'm almost done with most of the CPT book prep. You helped me so much. Yay! You take your CPC in August and you feel great about it. That's wonderful. Awesome, awesome. Louisa is new here. She's ready to learn. Yay. Awesome. So my point of view and what I teach here is how to pass any medical coding certification exam, whether it's from AHIMA or AAPC, from the exam point of view. So how we do that is we go to the answers first. We try not to read the questions at all. We look for coding irregularities, modifiers that don't go with certain codes, these multiplies times 2 times whatever that shouldn't be there, or if they should be there. Those are things that can give us hints on what the correct answer is. We've got a difference in this question with the 99393 and a 99392. That can be easily solved by one bit of information from the question, which is a patient's age, right? So we can go to those two codes, the 92 and the 93, see which age those codes cover, and then we can quickly either pick the correct answer or eliminate an answer right away with that. What do you guys think is the answer to this one? Just type it in chat. I got a fly in my room. Hey guys, can you guys see the question? Hey Patrice, hey Butterfly. If you guys are having trouble seeing the question, I am streaming on YouTube and it might be a better screen. All right, just making sure. Nobody has their books out today. 99392. Can you guys even find the codes? They are often out of sequence, messed up, rearranged in the book, out of numerical order, which is a pain. So we got the 9-2 and the 9-3. These codes right here. If you're in the 2024 book, I'm on page 36. So we know the 92 is only good for up to 4 years of age, so we know we can get rid of that answer quickly. The other thing that we need to know is how many components are inside each one of these vaccines. And you don't find that information in your CPT book. You would have to have that information down in your CPT book. And that information can actually be found. I give it to you free on my website. Let me get there real quick. And then if I turn that one on with the website, let me get my website back up. That's Facebook. That's not helpful. That's helpful. Okay. If we come to my website at medicalcodingbyjen.com, get rid of Facebook, you can see that we've got a shared gallery right up at the top. And here on this page, we've got some baby blue and pink little forms right here. You can just click on these and your far left and right sides are going to be the sides that you need. It's just moving really slow, my internet, because my computer, Windows, has decided it needs to update. So now my computer is going to pay me back for not updating today. Come on. These forms have the CPT code on one side, and on the other side it has how many components are in them. And that information you need to write down beside each vaccine. It's super easy since we've got it all listed here. My computer's just gonna take forever to do this. Come on. Work, 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 work. There we go. So there's a CPT code here on the left, and then how many components there are is over on the right. And just go to each one of those and write those down. That will help you out during your coding exam. So now that we have how many components are in each vaccine, wrong one, this one. How many components are inside our influenza vaccine? Does anybody know? You can type it in chat. Alex is going to lose their subscription benefits soon. Don't forget, on TikTok, if you do have this subscription, there's free pages and pictures of my notes available to you guys, so be sure and grab those and write the information down that's in those pages. Howdy, howdy. Influenza vaccine has one component. How many components does DTaP have in it? Does anybody know? You can put it in chat. This one is the one that has the 3. Yep. We add those together. We get 4 altogether. Perfect. Now, how do we bill those with the 60 and the 61? How many vaccines are we giving altogether? We're giving 2 vaccines, 1 influenza and 1 DTaP. You're supposed to be taking 1 component from each vaccine, and then that tells you how to do the 60 code, and then what is left out of all the components is how you do the 61. I find it easier just to count how many vaccines I have. I have 2 shots that I'm giving, so I know my 60 is going to be times 2, and then whatever's left over from the components. If my component started out with 4, I would subtract 2 from that. That tells me how much my 61 code will be times by. So now what do you think your answer is? Because I still don't see a correct answer in chat. There you go. There you go. Yep. C is your answer. Perfect. What about this one? We have a 15-year-old established patient comes in for wellness. What is going to be our answer? You need to get up here and eat this fly. I got 4 cats in the house. There's no reason for a fly to last longer than 30 seconds in this house. You are slacking on the job. Come on. You need to get up here and get that fly. What do you guys think is the answer for this question? On YouTube, I still do not see the correct answer. On TikTok, somebody does have the correct answer. We have a 15-year-old established patient who comes in for a wellness visit, receives counseling on diet and exercise, Physician spends 30 minutes on the counseling, which should be reported. Hang in there, Vicki. Yes, yes, yes. Indeed, A is your answer. We have a 6-month-old who visits for a routine checkup. We administer DTaP, pneumonia, and rotavirus. Do you know your components? Can you add them together? And then, do you know how to divide your components between your 90460 and 61 code? How many components are in DTaP? We did that one recently. Yep, we have 3. How many components are in pneumonia? Good. 1. And how many components are in rotavirus? Yeah, I can show you my website again. Just a sec. Yep, 1. So altogether, we have 5 components. How many vaccines did we give? How many shots? We gave 3, so we know our 60 will be 3, and then our remaining will be our 61. That's how I do it. So that tells us which answer is correct. And if you're having trouble seeing on TikTok, you can move over to YouTube. We're at Medical Coding by Jen on YouTube, and it's streaming live from there. Indeed, we are C. And to do my website again, I think it's this one. Yep. So to do my website again, if you go to medicalcodingbyjen.com, this is what the main page looks like. Then all you got to do is go over here to Shared Gallery. Go to the Shared Gallery. All these photos will populate. They're my favorite photos, favorite anatomy ones. How to get rid of your apprenticeship, how to bind your books, what pens do I use, how do I make my ICD-10 notes, how to get an extra hour for your exam, how many questions are on the exam. These are my favorite pictures. But these baby blue and pink ones, there's 3 of them in a row right there. These are the ones that have the CPT code listed in the far left, and then however many components there are is in the right. The other thing I would recommend you write down is the second to the last column is the name brand. Like if they call code 99707 Pediarex, then sometimes it's handy to have that name down, because sometimes in the exam questions they say they gave Pediarex, and if you don't know which one is named that, then it would be difficult for you. Sometimes you never have any questions at all on the exam with vaccines, And then sometimes you get the exam with 2 or 3 questions on it with exams. You never know. No 2 exams are alike, really. So just in case, I have those here free for you. There is a ton of free resources on my website, including free practice exam questions under the exam area right there, the practice area. You just click on the answer and it'll tell you what the rationale is. I have free flashcards that are meant to help you learn your E&M codes so that you don't need your book to do your E&M questions, which is very helpful. It cuts down on hunting down these codes during the middle of your exam, and it helps reinforce your knowledge in those areas. It's super handy. Don't forget to go to the resources tab. The FAQ page has right here under where is your best free resources, it has the links to a free grant, a free scholarship, free classes, just a ton of good resources that are wonderful. So please check that out. And if you haven't done so, we have a link on the front of our page, the big pink one, where you could join Pocket Prep and get access to 750 practice exam questions for very little money. What is it? $13, $15 a month for access to all those practice exam questions. They even have a pass guarantee, and the practice questions, they give you rationale, and they tell you what page number the answers are on, which is super handy dandy. Love it. Also on my website, we have a bonus membership area, so if you ever want to purchase a membership on my website, we do have practice exam questions here also, which are super cool. They do come with extra bonus PDFs you can download, and all the questions are answered individually. You just click on an answer and it'll tell you what the rationale is. And we've got just hundreds and hundreds of questions. I couldn't tell you how many I've been putting on here. I add some every day. I just play around with this and add questions in all those areas all the time. So just in case, don't forget to check out the blog. It's completely free, and there is a ton of resources here. This Elements of E&M, it's like 9 chapters of how to do E&M with practice exam question samples. It's really good. I've got, how to do the spinal injections, how to do revascularization, just a ton of great resources here for you guys with practice exam questions attached to them. So all free. Handy dandy. Click around. You can't mess up anything on my website. Just play around with it and click on the pages and see what you can find. There's my schedule of when I go live. I like to teach for free, and I do it 4 nights a week right now. The schedule may change over the summer, and it may change again during September, since today was my last day at my real job. I'm now retired, so I get to stay home with you guys, but my kids are home for the summer. I've got 2 15-year-olds, and we do have a couple of vacations scheduled, so it will be a little intermittent the end of this month towards the 1st of July, but basically my schedule's right here, and I do love to teach for free, so that's my favorite part of my day. Let's get back to our practice exam questions, and where is it? There we go. Get back to these questions. All right. What about this one? I have another D-tap and meningococcal. What do you guys think is the answer? Yes, I'm retired. Scary, scary. Oh, I was so mad at my job. I went, yesterday I was talking about it, how they had replaced me with 6 employees. I'm like, how in the world did they do that? Because I was making 6 figures. What in the world? And then I went on their website today and looked at the job offering, or whatever it is, opening. And they had at first hired 4 people to replace me. And then now they've got 6 in there this week. I don't know if 2 of them are bonuses because 2 people aren't aligning right with, I don't know, what are they going to really do all 6? But the job opening is for jobs that are paying $17 an hour. I'm like, no wonder you have 6 people in there. You're paying them McDonald's wages for auditing charts, and you want a bachelor's degree? I was like, what? And you want 100% accuracy. The advertisement actually says they want somebody that's 100% accurate. I'm not even 100% accurate. I don't know what the heck they're dreaming of. But I was like, okay, I'm not sharing where I work because I don't want none of y'all to go over there and start working for $17 an hour. Like, what in the... I don't know who's running that place, but good Lord mercy. Anyway, now I can talk about them. What do you guys think? I mean, at the very least, an auditor should be making $35 an hour, somewhere around there. I mean, you want them auditing charts, bringing you in money. I mean, the HEDIS measures bring in hundreds of thousands of dollars each year in bonuses at the end of the year. So my salary, as big as it was covered by one health plan. Blue Cross Blue Shield paid for all of my salary. Then any bonuses I got from Cigna, HealthNet, any of the other commercial plans was just cherry on top for having me. So they're good. Oof, good gracious. $17 an hour, up to $22 an hour. Like, really? Y'all are out of California. Prices of stuff is a lot more expensive out there too. Jeez, $5 a gallon to get to work, $6 almost. I don't know how they do it. $17 an hour. What do you guys think is the answer for this one, my guys? I do help you with ahima, absolutely. One of my very first people that I ever helped pass their certification exam was Janet. She was trying for her CCS. She had failed it and was going for another attempt. Found me on TikTok, and I started tutoring her, and she did pass. She was wonderful. Absolutely. A lot of my questions are a genre of both certifications, absolutely. When you go to your shared gallery, I cannot load any of the vaccine pictures. They load just fine, Samantha. Just wait for your internet to catch up and keep scrolling. They're there. They're also posted in our Discord group under the CPT resources room. You can find them in there too. So this patient also got counseling. They have a TDAP. How many components are inside that one? Meningococcal right here. We've got our counseling. What do you guys think is the answer? We don't have to worry about the first code. We just have to worry about the administration fees codes. scullery maid. Thanks for subscribing. We don't mix the 60 and the 72 together. That's a coding irregularity. We can get rid of that answer. That one would never be the correct answer. You got to keep your 60s and your 61s together and your 70s and 72s together. You're welcome. Thanks for sharing the live. Thanks for the 300 almost taps on TikTok. AAPC does the job salary report. Every year you can go to their website at aapc.com and put in your state or region, and it will come up with your salary, expected salary. They've already done all the work. I wouldn't know in your area. I live in Arizona but worked in California, which was perfect because the pay rate is higher in Cali than it is in Arizona, so worked out great for me. But I've been working remote since 2013, so 11 years working from home. This one is B, because even if the doctor does counseling, we don't use the counseling administration codes because the patient is an adult. Once you're an adult, we don't use the 60 and the 61 because of the patient's age. So all of them are coding irregularities except for B. Those 60 and 61 are only for children. What is the initial preventative physical exam, the IPPE, known as, and when must it be performed? Is it a welcome to Medicare preventative visit? Is it the annual wellness visit? Is it a routine preventative physical exam? Or is it a preventative screening, which occurs every 6 months? Ah, Scullery, she's prepping with my urology notes. I love my urology notes. Be sure to clear your headers in urology before you do anything else. That is the most important thing in that chapter. Be sure you get all of those written up there. If you've taken the exam multiple times and you haven't passed, one of my best advices, let me move this out of the way, sorry guys, is, and urology is a great example of this, is to go through this chapter especially and write the header on the page of what's being coded. The very first codes in urology are all about kidneys. So if your exam question gives you 2 codes here and 2 codes back here, here you'd know you'd be working on a kidney. Here you would be working on a ureter. So look through your question See if you're doing a ureter repair or if you're doing a kidney repair. That will help you eliminate 2 answers right away. So put your kidney up at the top. As you go through, every one of these codes is all dealing with kidney until you find you another red header, which is ureter. Half this page is kidney. The other half is all ureter repairs. So all of these are all ureters till you get to the bladder. This is still dealing with the ureter, but this side is dealing with bladder repairs. Everything in this section is all dealing with the bladder. You might go through the ureter to get to a location to repair something in the bladder, so be careful with those 2 things, but and there is a way to repair both. If you're doing ureter and bladder repair, both, look for that header. Write that up above, right there. Just clearing the answers and knowing what's being done by each CPT code will help you 100% in that section. So every section in the CPT book is just like that. Look for your red headers, clear those before you do individual code descriptor worry, before you worry about those. Anybody figure out the answer to this one? Everybody's saying C. It is A. Your initial, right here, initial gives you a hint that this is your welcome to Medicare. It has to be done within the first 12 months of getting Medicare, and it can only be billed once in a lifetime for a patient. How often can a patient receive an annual wellness visit under Medicare? Once, annually, every 6 months, not covered. Easy peasy one, right? B. Which of the following statements about the cost of an initial preventative physical exam, the IPPE, and the wellness visit, AWV, is true? Both the IPPE and the AWV require copayment and deductible. The IPPE requires a copayment and the AWV does not. Both of them have no copayment, or the AWV requires a copayment and the IPPE does not. Ooh, that was a mouthful. Indeed. Both do not. No copays for those. How do commercial payers cover routine preventative physical exams compared to Medicare? They don't cover them at all. They cover them with a copayment. They cover 100% of the preventative under the ACA, or they require a coinsurance and deductible. Good job, guys. Don't forget to comment in chat. Even if you don't know what the answer is, you can always put in chat what you think, where you live, what state are you typing from or country, and also when you plan on taking your exam, because I will be giving out free YouTube subscriptions in a few minutes, and they usually pick somebody that's been active in chat. What HitPix Level 2 code are used for the initial preventative annual exam IPPE and the annual wellness visit AWV? Is it A, with a bunch of G codes, B has CPT codes, C has CPT codes, D has HitPix codes? I've got 45 of you guys on and 23 likes. Thank you guys. That's awesome. And we got 300 likes on TikTok. Thank you guys. A is correct. Good job. Good job. Plan on taking yours in July. Ooh, it's coming up quick. All right, we've got 99396819696. Looking to see what our differences are in the 96 and the 81 before we do anything else. Because that way we can at least eliminate something or pick an answer. All right, 9396 is for 40 to 60-year-old established patient. And then our 81 is for somebody younger than 1 year of age. So we know we can get rid of that one. We have a 40-year-old. And follow-up means she's established, so 96 works. Does this look correct? Or would we have 00? We have a difference between I-11 and I-10. Looking for those irregularities or commonalities. What do you guys think would be the answer to this question? Thank you for the 300 likes on TikTok. Indeed, C is the correct answer. Good job. I've got more vaccine stuff coming up soon too. We're going to do some glaucoma stuff though first. This is for extraocular muscle entrapment and strab. Which of the following statements best describe extraocular muscle entrapment? Does it occur when the muscle inside the eyeball is damaged due to trauma? Is it a condition where the extra muscle or an associated soft tissue gets trapped in the orbital bone fracture? Does it refer to a congenital condition affecting the eye movement, or is it primarily a condition affecting the eyelids? What do you guys think? Lots of B's on TikTok. B is correct. Good job. How many extra muscles control the movement of the eyeball? What are they collectively responsible for? Gotta love my multi-question questions. 4, they control up, down, left, and right. 5, they control blinking of the eye movement. 6, they control complex movements of the eye in various directions. 7, they control eye movement and the eyelid. How many extra muscles are there? 4, 5, 6, or 7? Still don't see a correct answer in YouTube chat. I don't think I see it. Oh, there we go. There we go. Somebody on TikTok got it. There we go. It's C. I don't know why it says D there for a minute. There's only, I wrote the wrong thing probably. There's six muscles. Sorry, guys. Not 7. Just a typo. Only human. All right. Which ICD-10 code would be used for entrapment of the superior oblique muscle of the right eye? Oh my. Let's get out those ICD-10 books. H50. Do we know a quick thing about the 6 digits? I wonder if like the 1 is like left or 2 is right. Does anybody know? I wonder. Because that might help us figure out eye stuff fast. You remember like last night we were doing OB and delivery and we figured out that 1, 2, or 3 was first, second, or third trimester. I wonder if right and left is the 6 digit, but I don't know. Haven't played around with the eyeballs too much. All right, 6, 2. We're 50. 6, 2. 6, 6. Or 6, 2. Right eye is 1, left eye is 2, unspecified is 9. Ooh, that's helpful to know. 1 is right, left is 2. That's cool. So anything that says left we can get rid of, which is any 2s. So we can get rid of that one and we can get rid of this one because those are left. So we know it has to be that one or that one, and we just need to know the differences between those. And then it's probably the muscles, huh? The 2 is the inferior. This is the inferior muscle, where the 6 is the superior. And our eye was superior. They're both oblique muscles, but some of them are superior, some of them are inferior. Yep. pretty cool to know, though. Where's my pen? I'm going to make a note of that. So that I don't have to get down to the individual codes, I'm going to know that the right eye equals 1 and left equals 2 for our 6th digit. And just having that written at the top anywhere in this section near the eyeballs is super handy dandy. That way you don't have to think about it. Or get down to the individual codes, because it takes so long to get down there to them. What common term might be used to describe an orbital fracture in children that involves extra muscle entrapment? Is it open door, blowout, trap door, white eye? I got all this info from AAPC's Knowledge Center. They recently wrote an article about glaucomas and eye stuff. Absolutely, Samantha. Yep. I wrote the same thing in my book. I didn't have that down. And then in the OB section, you can write the 6th digit. 1 means first trimester, 2 means second trimester, 3 means third trimester. Anybody gonna take a guess at this one? Howdy. Good to see you. Are we open door? I got 1 vote for that. Blowout, trap door. I see that we have 2 similarities. We've got 2 answers that have door in it, so it's probably one of those. Open or trap? What word does this have in it? I'm always looking for associations. Yeah, it is C. Trapdoor. Yep. I see a lot of people put their kids in like a 2-wheeler or 4-wheeler go-kart situation, and they'll put one kid in the lap of another kid, and they'll put helmets on the kids, which is great, but the shorter kid, the smaller one in the older kid's lap, helmet is right there at the cheek level, and without a doubt, every time they go over a big bump and that little kid's helmet crushes the face of the older kid, and they get that orbital fracture, and then their eye is always droopy for the rest of their life. No matter how many surgeries they have, they can't get it back to 100% the way it was. That's one way we used to see this happen all the time. Don't let your kids sit in each other's laps when they're going over bumps, because that will lead to fractures in the face every time. What is a function of the superior oblique muscle? Does it control elevation, abduction, and intorsion? Does it control depression, abduction, or extorsion? Does it control downward, inward, medial, inward rotation? Does it control upward, outward, lateral, outward rotation of the eyeball? I don't think it does anything with depression, but other than that, what do you guys think? See again. It controls the downward, inward, medial, inward rotation of the eyeball. Which of the following ICD-10 code is used for unspecified? So we know the 6 digits going to be 9 if we're unspecified, because this is like one's right, one's left. We know this is unspecified, right? Extra muscle entrapment of the left eye. Ooh. What do you guys think the answer is? Are we an 8 or are we a 6? And if you can't find these codes in your ICD-10 book, it may be because they're new for 2024. Maybe, I think. I'm not sure. But they might be new. That may be why they wrote an article on them. Thank you for the 1,000 likes on TikTok. Hey, Sierra, how's it going? What you yelling about? I'm doing great today. I am a free, retired woman. Now, I can lay in my pajamas. Well, I already do lay in my pajamas all day long, but, you know. I did shower today, which is good. For the last day on the job. Job. That's all right, Elizabeth. Get them all wrong. You won't get them wrong again if you see these on your exam. I know, life goals. Retired and don't have to shower now. No more Zoom lessons or meetings that could have been an email, you know? Jeez. Just got to pay for that health insurance for me and the youngins because they're only 15. So that's the hard part, is taking that over in July. And Cobra is ridiculous. And then so I bought into the Arizona plan, but geez, Pete, it's ridiculous. And you'd think buying a health plan, you buy it and you pick it out and you think, okay, this is what my monthly payment's going to be per month for at least a year until open enrollment, right? And then you got to pick out another plan. Oh no, the health plan can change the amount of your monthly rate monthly. They can increase it every single month for that 12 months. I didn't know that. I started paying last month just to see what it would look like. And then this month, of course, everybody's rates are going up. And I'm like, why? I picked the plan a month ago. Shouldn't it stay this rate for a year till open enrollment? Oh no, we can adjust the rate monthly if we feel like it. Oh, great. U.S. healthcare. So planning a particular payment is out of the question for if you want to ever purchase your own health insurance. By the way, don't think that that is your price for a year. It's, even though they base it off of your tax return, which is a year's salary, right? That's one number. This one, the answer is B. Advanced medical code. Oh gosh, why did I do that? Okay, glaucoma diagnosis and documentation. What is glaucoma and why is comprehensive clinical documentation critical in management? A curable condition affecting the cornea, leading cause of blindness due to optic nerve damage, an acute eye infection treatable, or a condition causing temporary vision loss. Seriously, Kim, I don't understand how they can raise your rates monthly. I don't know. I mean, one kid went from being 14 to 15, but I don't know. It's crazy. I go yell at my kids. Speaking of that. What is this? Turn it down. More. Turn it down. Travis turned on the musical. B. Glaucoma is the leading cause of blindness due to optic nerve damage. Nothing curable about glaucoma. Lots of people go in for lens replacements and stuff like that, but it's just temporarily helping out things. Which of the following best describes pathophysiologically of primary open angle glaucoma? Is it a sudden blockage of fluid flow because of acute symptoms? Is it fluid passage is too slow through an opening due to a drainage angle? Is it a complete blockage of fluid, or is it an inflammation? Sudden, a slow, a complete, or inflammation. And we're talking about open angle glaucoma. Both of you turn it down. Both of you are competing against each other. James. And they're rocking out. Oh gosh, car insurance. At least the car insurance doesn't go up every month. Mine goes up every 6 months, right? When I do the auto renewal thing. And that's a pain, you know. I use Root Insurance, which is cool because you download an app, you put it on your phone, and then they follow you and your phone and track you for one whole month and see how many miles you drive, how fast you stop or brake. You have to be careful with that because what if you're riding with somebody else or take an Uber somewhere? Their driving affects your insurance rate. But I work from home, so I don't go nowhere. And that was one issue they had with me is like, you got to drive. You got to go do something. I'm like, okay, I'll go. So just, you have to drive. But I was able to completely control the environment because I could pick and choose when I got in my car and went anywhere, and made sure, you know, I didn't have to be somewhere fast or important, and you know, and then was able to get a really good rate. But it's been a couple of years ago, and they keep going up every 6 months when they auto renew. So it's time for me to get a new car insurance policy too, because it was a great rate. Now it's not so great anymore. But I couldn't believe that the health insurance can change the rates monthly, even though you got to lock into one plan for a whole year. This one is B. In the primary open-angle glaucoma, even though the drainage angle is open, fluid just passes through so slowly that pressure builds up in the eye, and that damages the optic nerve. How is laterality and stage of glaucoma indicated in the ICD-10 codebook? By using codes that specify only the type of glaucoma, by using codes that include the type, laterality, and the stage of the condition, by using single codes for glaucoma types, or by using unspecified codes if the type is unknown. Thank you for the 1,000 tappy taps on TikTok. Finally got one correct. Yay. B. You know they have a number for just the laterality, right and left, bilateral, unspecified, and also if the case or stage is mild, moderate, intermediate, or severe. What should be the code for a severe primary open angle of the right eye? Right eye, we know it's a number. We know the 6 digit would be what number? You should be able to pick these out without having to open up your book if every answer is different, right? Right is, I don't know about being 2. Right was what? What did we write down in our books? H. 50, somewhere around in there. What did I write in my book? What did I write in my book? Right was 1, left is 2. Super handy dandy to know that. Then you don't have to open up your book. And remember, it's the 6th digit, not the 7th digit. Perfect. Should be almost done with these glaucomas. What is absolute glaucoma? How is it coded? Is that an early stage of glaucoma? Is it a final stage? Is it glaucoma without increased pressure or unspecified? It's too distracting for me, baby. Turn it down. Your light is on in your back bedroom. Final stage of glaucoma. Perfect. When coding for glaucoma, what does unstageable mean? Does that mean the physician did not document the stage? The physician was unable to determine the stage is early and unnoticeable, or the glaucoma is bilateral? Doris, thank you for the gift on TikTok. It's incredibly generous of you. Thank you, thank you, thank you. B is correct. Good job. What types of glaucoma develop without increased eye pressure? Is it closed, normal, secondary, angle? Let's see, how many do we still have on? We still have 34 on YouTube. I know it's getting late. Sorry about that, guys. We've got some more E&M and vaccine ones coming up. If you guys can stay awake, let's give away some YouTube memberships. Give away some YouTube memberships. Who won? Elizabeth, Christine, Medcoder, Janet, Sierra. Nope, Sierra answered a question. Sorry, sweetie. And Juanita. Juanita, I think you've won before. Yay. Congratulations, guys. I hope those subscriptions help out. You guys get access to all my exclusive videos, the individual book prep. I'll be doing exclusive lives that are just for the YouTube membership now that I'm retired and rely on you guys to help pay for that health insurance that keeps going up monthly. So I'll be going live just exclusively, bonus time for you guys. Lots of other content will be coming up. So super cool. You also get access to all the old workshops, which have 75 practice exam questions, all in 3 hours, same time frame that we would be doing during the exam, which is super helpful. Medicare beneficiaries are covered for glaucoma screening for every 12 months. Is it beneficiaries under 50 years of age, beneficiaries with no risk factors, beneficiaries with high risk, or beneficiaries regardless of any risk? All right, so Samantha. Yes, there are different types of nerves. So when you're in the nerve section, we are dealing with a header right here of what's our header? Our header for this is extracranial nerves, peripheral nerves, and autonomic nerves. Now underneath that is a subheader. This is dealing with all somatic nerves. The definition will be right there. We go through that, and then we'll be dealing with, underneath the same red header, because we haven't changed red headers yet, now we're doing paravertebral spinal nerves. Definition will be there. All the codes after it. These are all paravertebral. Then you get to somatic nerves. Then you get to sympathetic nerves. So they're all just subheaders, and you need to know the differences between those definitions of which ones they take care of. But a quick Google search between what's the difference between sympathetic and somatic nerves will definitely give you a layman's terms of what those differences are, and you can write that down right there in your notes. This one is C. Which of the following statements is true about REM, para, insomnia, sleep disorder? This is also from an article that AAPC recently wrote, and they gave some exam questions in this area. So I thought it would be a good time to write up some practice questions in this area. If we're talking about REM, parasomnia, sleep disorder, does that occur primary during non-REM sleep? Are they marked by excessive daytime sleepiness? They involve dreamlike state muddled into reality, or they are characterized by difficulty falling asleep and staying asleep. Awesome, Elizabeth. I hope it helps out a whole bunch. You're no worries. Oh, I hope your daughter gets better. Thank you for the almost 2,000 likes. How many did we end up on YouTube? 34 likes, and we got 44 people in. Awesome. Think about your prefixes. What does para kind of stand for? What other conditions do you know that start off with that? What do you guys think the answer is? I still don't see a correct answer in chat. It is C. It is what's some of those parapsychosis things that reality gets muddled up? Yeah, with reality. Yep, it is C. And all from sleep disorders, right? Which sleep disorder is characterized by an inability to move upon waking and is often accompanied by or with a hallucination? Is it sleepwalking, sleep paralysis, insomnia, or narcolepsy? Sleep paralysis, yes, that can be pretty terrifying too. But it's just a sleep disorder. Nothing's, totally wrong with you. You just need to find a better way to sleep. What is the most common type of sleep-related breathing disorder? Central sleep apnea, obstructive sleep apnea, hypoventilation, or catarrhea? Whatever. What do you guys think? We've got two similarities, central and obstructive. They both end in sleep apnea, and it is obstructive. Which sleep disorder is most likely to be associated with extreme daytime sleepiness despite adequate nighttime sleep? Insomnia, restless leg syndrome, hypersomnia, or sleep terrors? Hypersomnia. Correct. Good job. What classification does restless leg syndrome fall under? Parasomnias, sleep-related movement disorders, central disorders of the hypersomnolence, or circadian rhythm disorders? I heard people have been having trouble in the South with those cicadas, the little flying bugs. They come out this year with a vengeance. I'm sitting here in Arizona and I'm dealing with one fly I've seen in the last 10 years. We don't have very many insects. We got little lizards and spider kind of like things, but most everything stays away from humans around here. Correct. Easy peasy. Sleep-related movement disorder. Which type of sleep disorder is often treated by addressing the underlying medical condition like GERD, anxiety, or depression? Parasomnia, sleep-related breathing disorders, insomnia, or a circadian rhythm disorder? Insomnia. C. I didn't see anybody with that answer. Having insomnia comes from having anxiety, depression, even reflux can bring that on. What is the primary feature of a circadian rhythm disorder? Is it involving movements during sleep, difficulty falling asleep and waking up at the desired time, episodes of intense fear and screaming during sleep, or sudden muscle weakness during waking hours? Circadian rhythm disorder. B. Difficulty falling asleep and waking up at the right time. Yep. My oldest has that problem. Which ICD-10 code might support the medical necessity for sleep study due to suspected obstructive sleep apnea? Would it be a symptom? Would it be probably a mental health issue? Or would it be one of the G codes for pain? Or I wonder if it's reflux or something. Interesting. What do you guys think would be a supportive diagnosis for getting somebody a sleep study done? Kristen, yay, I'm so glad. Awesome. I hope it helps you out. Those duck classes are also great that are included in the subscription. Those are 2 hours of advanced questions. Super hard, tricky ones. Really good for people that have already taken the exam and didn't pass and want to try again. They go into questions that dive into tiny little details you might miss in doing the normal process with questions. If you're just looking for similarities, irregularities, and doing a word search and picking out answers and you're still not passing, those questions show you some other tips that find reasons why you need to look one more word ahead or behind your word search stuff. And they show you how AKA terms can trick you into picking the wrong words or wrong answers sometimes. So they're a fun class. We have discussions about questions, and they're pretty defeating too, so don't think that if you watch one of them and you don't get any questions correct, that's my intention. So don't feel like you're the only one. I build those questions or bring the ones that I know for a fact are going to be wrong when you guys look at them. So don't take it to heart if you watch those. It's not a true expectation of an entire exam. This is the extreme, out of the ordinary, oddball questions that come up that are built to influence you to pick the wrong answer. So, and to have 2 hours of classes with multiples of those back to back is rough on your ego. So don't take it to heart. Just take the notes down, add it to your books. That way, if you see that example during your exam, you will know it and you'll know what the answer is. I know people come and they attend those classes and they're like, I didn't get anything correct. I'm such a terrible coder. I don't know what I'm doing. I don't know why I'm here. And I'm like, oh, don't feel that way. That was my point, was to miss every single one of them. So that's my job, is to bring you there and show you stuff you would normally get wrong. At least that's my interpretation of what my job should be. Which of the following elements is not included in a chiropractor's initial patient visit and examination? Treatment plan, days, durations of visits, surgical history, or frequency of visits? Can everybody hang in for 30 more minutes? Since I started late at 6:30, if we're going to get our 2 hours in, we got 30 more minutes. I know it's late where y'all are at. Surgical history is not needed. Yep. We just need to know the treatment plan, the duration of visits, and the frequency of visits. What is the primary reason for 30-day duration of chiropractor visits? Is it insurance policy requirements, validation period of outcome assessments? Is it patient's convenience or standard of practice? I know it's past your bedtime. 25 more minutes. 25. Don't forget, I got a membership on my website too of hundreds and hundreds of practice exam questions with rationale. I have oncology up. I have orthopedics, OBGYN practice questions. Those are super helpful because I do the triplets, which I know is on the exam right now, is a question about how to deliver triplets when a couple of them are natural and one of them C-section. What's the answer? I've got my own example of that question there on that page. Tubules, other things that go along with it. So OBGYN is pretty cool. Set of questions. This is B, validation period time. Got to make sure that they are going to get better. Give them 30 days of treatments, and then we reassess. What happens during a routine chiropractic treatment visit if a patient presents with a new problem? The new problem is noted for future reference. The doctor conducts a new initial examination. The treatment plan remains unchanged, or the patient is referred to a specialist. I know. I hope I can start classes soon. I know for a fact at least until mid-July I won't be able to start classes because the boys have so much stuff going on right now. But we should be done with vacations and stuff by July 10th, 11th, 12th, 13th, somewhere around in there, whenever we get back from Minnesota. So I'll need a couple of weeks for things to calm down and get back to normal and get unpacked. And then maybe I can even start some classes in August instead of September. We'll see. I'm excited to get to a routine too. It's scary out here without a job, so I just think about that tomorrow. That's a tomorrow problem. This one is the doctor conducts a new initial examination. Which of the following is best describes the purpose of a re-examination during chiropractic care? Is it to ensure the patient is receiving correct billing codes, to establish a baseline for patient's condition, to measure the patient's progress, or to discharge the patient from care? Crafty one, good to see you. Thank y'all for the 3,000 taps and the almost 40 likes on the TikTok, YouTube, I mean. Thanks for all the shares. C is to measure the patient's progress. That one was easy. What should be included in a proper documentation request from a chiropractic care person to review? Documentation from a patient's initial visit, documentation from the date of service, documentation from the examination before and after the date of service and in between, or documentation of the insurance policy. Another easy one. C. Before and after and all the treatments, include it all. What might indicate a need for a deeper investigation into chiropractor documentation, a regular 30-day re-evaluation, a consistent treatment plans, change in diagnosis without corresponding examination, or a detailed patient history? A good CPMA question for this one. Yeah, C. If you're going to change the diagnosis and don't document why, we're going to come investigate. Why is it important to request a comprehensive documentation when reviewing chiropractic care? Is it to ensure billing's correct, to verify insurance coverage, to accurately determine medical necessity, or to understand the chiropractor's personal practice methods? Crap, what a sentence. Another easy one though. Medical necessity is always going to be the correct answer when you get those. A provider evaluates a patient with a new onset of symptoms that could be representative of a high morbidity condition, but after evaluation determines that it's not serious at all. What does this do to the scenario for the level of MDM? It lowers, it doesn't influence it at all, it raises the level, or it's irrelevant. Did we do this question yesterday on TikTok? I think we did this question yesterday. We have a patient who has a new onset of symptoms that could represent high morbidity condition, but after the evaluation we determined it was not serious. What does that do to influence the level of MDM? definitely raises the MDM level due to the potential of the high morbidity of that condition. Even though we determine for this particular patient it's not so serious, in a different patient it could be very serious, but it's still a risk because it is a diagnosis or symptoms that does have, no matter what, a high morbid condition. So it still raises the MDM. If a patient presents with a stable chronic illness and the provider prescribes a new medication, how does that reflect in the MDM? I know we did these recently. It does not contribute to MDM. It contributes to a low level. It contributes to a moderate, or it contributes to a high level. I know I've got another vaccine coming up pretty soon. So hang in there. Don't go to sleep yet. C is today's big winner. C and B. I think I had one D for some reason, but it was supposed to be C because it's 6. Lots of B's. A couple of A's at the very beginning, I think, but most everything is B's and C's, yeah. I've got some A's and B's coming up soon, I bet. This one is C for moderate. A provider orders an x-ray and a urinalysis. What does that do for the level of data, MDM? Is that minimal, limited, moderate, or high? We have 2 unique tests. One urine, one x-ray. Medication is always moderate. Even if you prescribe over-the-counter meds, it's moderate. For risk, anyway. This is limited, right? Because we have 2 tests ordered. 2 unique. You're going to use the chart on page 8 and 9 of your CPT book to find that answer. In an outpatient setting, a doctor reviews a chart note specialist from a specialist and discusses the management plan for the patient with another healthcare professional. How should this be classified in MDM? Is that minimal due to the review of the chart notes, limited since the chart notes and the discussion count as 2 separate elements, moderate because the discussion with the external professional is involved, or high due to it involves coordination of care of multiple professionals? So we have a provider that reviews charts, notes from a specialist, and discusses the management plan for a patient with another healthcare provider. Are we minimal, limited, moderate, or high? Anybody care to guess? I don't think we've done this question recently. C, moderate. Reviewing the chart notes is one unique source, and then discussing the management of the patient with an external professional is a separate element. During a patient's visit, the provider orders a basic metabolic panel and reviews results previously ordered of a CBC. According to the guidelines, how does that impact the data component of MDM? Is that minimal 1 test, counts as limited 2 unique tests, contributes to a moderate data, or is classified as high. It is minimal. It's only counted as one test because the day you order the test is the only day it counts towards MDM. So we ordered this test today. We ordered this test on a previous visit. That means it was already counted during that previous visit's MDM, and we can't bill to review the results on another visit because that's double billing, that's fraud. You get in a whole lot of trouble for that. So we only count results the day or tests that we order on the day that we order them. When they come back and review them, it does not matter about data on that day. Now, in real life, your own policies and procedures will be different. A lot of times we only count them in the office when they come in and get them reviewed, not the day we order them. But according to AAPC and what they want to see on the exam, that's the exam result they want. A patient with poor controlled hypertension comes in for follow-up. The provider adjusts the patient's medication regimen and discusses the importance of medication compliance. How is this reflected in the risk component for MDM? Minimal, low, moderate, or high? Now, if it's ordered and reviewed in the same day, meaning you did the result in the office while you saw the patient, then of course you get to bill it for that particular MDM today. What we were doing was reviewing something that was ordered on a previous visit, and they had to go to the lab and get it drawn, and then they had to come back and get the results. So it's a whole thing there. But of course, if you order it and do the results on the same day, like a urinalysis or something, then absolutely count it for today's MDM. C is moderate. Any kind of drug management is always moderate. All right. We've got integumentary. Do we have a intermediate versus subcutaneous? Probably. Looks like. Would we have done 3 procedures, 2 procedures, 2, or 4? I forgot to contact ahima, Pocket Prep on that question yesterday. I need them to fix. Forgot about that. Arms and hands are billed separately. They aren't combined. Foot is also billed separately. Foot and hand could be combined, but arm is separate. Hey Twinkle, did you just get off work? Or not yet? I don't feel retired yet. I gotta ship all these equipment back to them, and remember not to get up on Monday morning, Then maybe I'll feel retired. I know I'm going to feel retired when 2 weeks come up and I don't get a paycheck. That's going to feel real retired. and my health insurance. Geez, Pete. You lock into a contract for a year and you think, okay, they tell you this monthly price, this is how much it is. Oh no, the next month they can raise the rates. The next month they can raise it again. They can raise it every month for a year. Oh. Hey Nate, how's it going? Good to see you. But yes, I am officially retired. Work when I want to. B is the correct answer for this one. Good job, Mabel. Good. Good job. Good job, Alex. Last one for tonight. We have another established patient getting a well child exam, and they also have a ear infection. What would we code in this situation? Are they a 92 or a 93? Eliminate those first. That'll get you down to just 2 answers. What do you guys think is the answer? Thank you for the 5,000 taps on TikTok. How many did we end up on YouTube? We ended up with 34 on YouTube. Cool. What do you guys think? Our answer is not C. What level visit would an otitis media be? That is a acute illness, or how do they classify that? Minor limited problem or illness or whatever. What do they? Would that be a low or would it be minimal? Did you check the age of the 93 go-kart? What's the age involved with the 93? '93 says 5-year-old to 11-year-old. We have a 3-year-old. So we know we can't be a 93. So we have to get rid of C and D. They have the same answers there and there. The only difference is a 2 or a 3. You got a lot of the critical care questions today. Those are easy peasy, right? You have that critical care chart. Don't do critical care by the CPT code descriptor. You just look at the chart in our critical care section and do it there, because if you try to do the math like in subtracting minutes or whatever, that'll get you wrong answer every time. Just look at that right there, and then it will tell you what the answer is based off the minutes or the hours, whatever. You got for less than 20 minutes, then you know it's the appropriate E&M code. So it would be admit hospital probably, or ER visit. Yep, yep. Anything less than 30 minutes. Good, ER. Good. Then it's probably an 85. If you are worried about respiratory, they're crashing, you're doing CPR for 20 minutes, that's a level 5 probably, so probably an 85. Do you think it's okay to take the CPC exam with the 23? Yes, Ada. Did you correct the book so that it looks like a 2024 book? I have a document you can download off my website that'll change your 2023 book and turn it into a 2024. I have that for the ICD-10 and for the CPT book. Really would just use it just for the CPT, but this one is B. B is the answer. That's it. That's all the questions I had for tonight. What else did you have on there, Nate? Do you know if you passed yet? Have they had a chance to grade it? No, not yet. I know your mind's a blur. They said 7 to 10 days. It's always the same day. Should be within a couple of hours. But I hope for the very, very, very best. Absolutely. Hope you passed. You checked it's not graded yet. Good gracious. What books do I need to take the exam? If you're talking about AAPC, CPC, you need an AMA CPT book. You need an ICD-10 book from AAPC 2024. And then you need your AAPC HitPix book. I don't recommend buying them from AAPC because they charge you $20 per book to ship it to you. So just Google these books and find them elsewhere. Book Run is a really good bookstore to get books from. They ship for free and people can sell their books to them. Like if anybody is done with their books and wants to sell them, you can sell them to Book Run and they will purchase them for you and sell them to somebody new. We also have a Discord study group that has people in there selling their books. Let's see. And let me get rid of that. And then let me bring this up. Is that it? No. This is it. I've got it on. Who have we helped? Here we go. There's our Discord group. And we have a room over here to the side. It's called Sell Your Books. You can see people have got books for sale, study guides and stuff like that. You can come in here and purchase them if you wanted to. But you can also do a Google search and find you some too for cheaper. Did I remember to tell everybody I was going live? I don't remember. But normally I tell y'all when I go live here in our Discord group, so be sure and join if you haven't yet. There's a ton of practice exam questions and rooms based off certifications. CCS, CCA all have rooms in here too. Yep. And look, this Taylor, she took her CCS and she said people were asking her what was on the exam, and she was like, exactly what Jen said was on it, on this post right there, which is really cool because if you look back at that post, I listed out exactly what was on the exam right there. Tons of help there inside our Discord group. Plus there's, years and years worth of information inside this book. I was in there today. What did I post in there? Something in the E&M resources. Oh yeah, this page is got all the that Medicare stuff that we just did those practice exam questions on, about the IPPE and the AWV. This chart gives you all the basic information in it. So that's in our Discord study room. Super handy dandy. And right there. Social media. Yeah. Where am I at? Right there. Yeah. That's my website, Medical Coding by Jen. In case y'all haven't been there, the link to Pocket Prep is right there. 750 practice exam questions with page numbers where the answers are. The link is the big pink one. Super handy dandy, and they only charge you $40 for 3 months worth of access to those questions. It's a great resource. My resource tab has a lot of cool information. How to book prep your books, where to find all the free resources, book prep videos are there. The blog is super handy dandy. I have a list of places that are hiring. A 9-chapter book on E&M alone. There's tons of practice exam questions in there too. We have a practice area with practice exam questions. You can just come here and click on it. There's a lot of modifier questions right there, and it'll tell you what the answer is and rationale. If you do want to buy a membership on the website, we do have a ton of practice exam question room area. OB and delivery just finished, super cool. You can click on the answer and it'll tell you what the rationale is. But I got tons and tons and tons of practice exam questions for OB and delivery here. Like I said, I got the triplets in here somewhere. I don't know where, but every question you just click on it until you find your correct answer. Go-Kart likes the ones that I tell you why it's incorrect. That's hard to do for every single answer when it's incorrect. Woo! And then when you finally do pick the correct one, it tells you why it's correct. So she likes those, but I don't have it done for every single question. But I try. I don't know why. It keeps changing up the format on some of these questions, but OB and delivery just goes on and on and on forever. I got tons of E&M. Cardiovascular, I was just adding to yesterday. Super cool. Lots of practice exam questions there. Covers the medicine part of the section of cardiovascular and Appendix L and the 30,000 codes. So it's for everything that's got to do with cardiovascular. Even diagnosis codes. Anything that has to do with cardiovascular is covered here. So super handy. And don't forget about the shared gallery. It's totally free for you guys. Those OB and delivery or those vaccine components codes will definitely pop up. They're right here in the pink, green, and blue. I don't know what the site looks like on your device, but it might be better to look at it under on desktop mode. So even if you're looking at the website on your device, let me see if I can turn this on. Yeah, there we go. Let me go to here and go to Medical Coding by Jen on your device. It'll have a different view, of course, but you can click the top little buttons in the corner and change your device to show you desktop mode of my website. Then you get a bigger view of the website. So if you have an Android or another device, don't forget you have that option to change your settings to desktop mode, which will give you a better view of the website, which is always handy to have. Favorite pictures are here of what books I use, what pens do I use, how to get an extra hour to take the exam. You can do it in 5 hours instead of 3. How did I get rid of my apprenticeship? Before I even took my certification exam, I sent them my college transcripts and a letter from a friend saying they've seen me use the books, and that got rid of my apprenticeship before I even took the exam. You guys can do the same. Super handy dandy. Lots of information there for you for free. I hope this is helpful. I will be back, I don't know when, but especially on Monday. Mondays are our schedule for going live. But I do have the schedule posted here underneath the social media links of the hours and days when I go live. But I'll be around. I chat in Discord and let you guys know when I do bonus lives between now and Monday. But I hope this was super helpful. And Nate, I hope you passed. My fingers crossed for you. Please let us know if you passed or not. Come back and share the good, the bad, everything. We're all here for you no matter what. And everybody send good wishes out to MK. She lost her mom. And we want to send her best wishes. And y'all keep the emails coming at medicalcodingbyjen.com or gmail.com. And let me know if there's any particular areas you'd like me to go over on the next live. That would be awesome. Or what kind of TikToks y'all want me to make, or my next video. Be sure and comment on any of my videos. Let me know what you would like to see. Give me ideas, because sometimes it helps just to have somebody ask for something. Then that gets me in the mood and I create the video. So that helps me out. Don't think that y'all are bugging me, but it does help when y'all ask questions and post up for me. Love you guys. Love you guys. You think you're going to skip Practicode? I hear horror stories about it. Yeah. You feel so defeated you don't know any answers to any of the questions. I tried to make them super hard today. There's a few that were super easy, but that's my specialty. I wrote all these questions. They're not from aapc. They're not from ahima. So everything you saw today was from me, and I tend to do that to everybody. So don't take it to heart. I wrote them from aapc's Knowledge Center. So I use their knowledge, but I tend to write really hard ones. So don't take it to heart. It's meant to make it better for you. If you can even answer any of my questions, then you know when you go to this exam, CPC exam, it's going to be a piece of cake compared to what I put you through. So don't worry. Don't worry so much. You're going to do great. Hang in there. Love you guys. I'm so very proud of you guys. I couldn't see you on TikTok. Oh, sorry, Ada. Yeah, I've got you in a cup here on my desk, staring at a screen on my computer. So TikTok doesn't have the best view tonight. They will on Monday. But I'm streaming live on YouTube, which is the better view for tonight, of course. I hope this is helpful. Y'all get some rest. Hopefully I will see you guys. We'll do some free lives Saturday or Sunday. I don't think I have any plans. Saturday we've got tumbling camp or something with cheer. Other than that, pretty okay. I'm going to decompress from having the job, and I got to ship some stuff out tomorrow. But love you guys. I hope this was helpful. And thanks for letting me retire from work after 30 years in medicine. That's crazy. It wouldn't have been able to be true without you guys' support. So pretty cool. Thank you so much, guys. I wish you'd have found me sooner too, Vicki. All right, keep the comments coming. Let me know what videos to make, what you need me to make. Give me some inspiration. Let me know what you need, and I'll get to work on it. Love you guys. See you guys later.